Good afternoon, Dr. Tucker. It's a pleasure to have you on our podcast today. We're looking forward to hearing from you as an expert in the areas of addiction and mental health. Before we really get into all of it, I'd love to learn a little bit more about your background.
Sure. My name is Dr. Lawrence Tucker. I trained at UCLA for undergrad medical school and did my residency there as well. So I was there for a total of 16 years. I was on staff there as well. After that, I went out practicing psychiatry and addiction medicine fairly early in my career, back in 2002, and have been out in Orange County area now for at least the last 20 years.
Wow.
Working in the substance abuse field. I also was the medical director for about 6 or 7 years at the Long Beach VA, running their substance abuse program there, and established the first MAT program within the VA system, so that was pretty cool. That continued to practice out in the community and some rehabs, do mental health, and as well as consult in Orange County judicial system for their diversion program in Santa Ana. And I also do some consultation and some expert witness in state and federal court.
Well, that's a lot of experience in this field, and I mean, you've seen the trajectory of addiction and mental health as the disease has become more aware to the public over the years. We're definitely happy to have you at Ocean Rock as our medical director, and the value and experience you bring is probably second to none in Orange County and in Southern California as far as the practitioners that I've seen. You've been doing this for so long. How would you say things have changed along the years to where they are now?
I certainly say over the last 20 years, our clients are coming in with a lot more medical problems, as well as a lot more mental health problems. I would say 20 years ago, even maybe 10 years ago, certainly you didn't see as many of your patients coming in with so many mental health problems, again, as well as very serious medical issues because of their addiction. So you're seeing people coming in with very severe addictional issues, a long history of it, as well as serious medical problems that you're treating, usually due to their substance abuse. So over a period of time of substance use, you obviously can get more medical problems, either heart disease or diabetes and other things that we're treating. And again, even with the mental health, putting yourself over periods of time with substance use certainly sets you up for anxiety, depression, PTSD, other issues. So it is getting overall more complicated because, again, you're not, back then, 20 years ago, you're just treating someone with addiction, you're detoxing, stabilizing, right, and then they were leaving. You weren't having all the other comorbid issues that you're also treating, which is important because if you don't address those issues while they're in treatment, they don't fare well, and then they end up relapsing or succumbing to their illness or their substance abuse or one of their other medical problems, or even high risk of suicide because of their comorbid mental health issues.
Right, so it's an opportunity for the client coming in to be able to really take a holistic look at all the different things going on, physical, mental, and address all those issues during their treatment.
Absolutely.
How about the actual the drugs and the substances that they're addicted to? How have you seen that change over the years? And, what are the things that are prevalent now that really weren't as big of a concern back then?
And I think that correlates also to the increase in the medical issues and mental health issues because the drugs are becoming much more significant and harsh, right? I mean, of course, back then we were looking at more, obviously the opiates were there and the alcohol was there and the methamphetamines and benzodiazepines are kind of like your main four drugs you see in detox. Now, of course, with fentanyl over the last 10 years or so and other derivatives of fentanyl like synthetic drugs, and in mixing those drugs, typically you hardly ever see fentanyl by itself.
Right.
There's methamphetamines or cocaine or other drugs involved there as well. So the significance of that has increased as well.
Right.
So And I think that's a direct correlation of the increase in medical problems we're seeing and the high risk of relapse and overdose, as well as the mental health. So definitely it's directly correlated to the drugs.
Got it. You mentioned fentanyl. That's the big F word in our industry. And can you tell the viewers a little bit what is fentanyl and why are we so scared of it? Why do we hear it on the news? Just give them a little bit more information about it.
Well, it's a synthetic opiate, and what makes it so disturbing is such a small amount is so strong, 100 times more powerful than heroin. So therefore, the addictive qualities are that much higher, and such a small amount can lead to an overdose. And then, of course, our naloxone we currently have the opiate blocker that people use when people overdose is taking 5-6 times the amount that you would typically use for heroin to get someone out of an overdose. So extremely powerful. They're very cheap, extremely cheap.
Right.
And since it's synthetic, it's much easier to find because it's really easy to produce, very easy. So it's saturated the market all over the place. As a matter of fact, it's much more difficult these days to find the old China White or black tar heroin that was around 10 years ago. Almost impossible, really. And a lot of things correlated to the increase in fentanyl. It's harder to get the opiate pills like it was back then, the OxyContins, the oxycodones. They were less lethal, but obviously there was a problem. But when DA started cracking down on them and it was harder to get the prescriptions, in comes something even harder, right? You almost wish the DA wasn't so harsh with getting the prescriptions because that opened up a door for, okay, we're going to get it a different way. And then the synthetic drugs came about, and again, much easier to get. $5 can get you a significant amount. And it's the addictive quality of this drug is really uncanny. It's really sad.
That's amazing to just see how easy it is to get out there and how easy it is to produce. Like you were saying, for a while we hear a lot about oxycodone and other opioids that are addictive, and obviously that led to a lot of this epidemic that we're seeing with addiction, just in terms of the masses and everybody getting access to that. So that was a huge issue. But now the byproduct of that is as they crack down on that, like you're saying, the fentanyl is getting out there, and that's just easy to produce. It's harder to find, harder to block and harder to deal with. And so,
and even to taking a step back, I remember when I was in training back in the late 90s, I remember in residency, the whole premise was to treat pain, to treat the seventh vital. We call it the seventh vital signs. There was this huge paper came out of Harvard about treating pain, needing to treat pain. So we were, unfortunately, your mentors and your professors was telling you to push the opiate drugs, right? We prescribed opiates like it was, unfortunately, Skittles. Because someone was in pain, we would give them opiates.
Just give them the opiates. Right?
We would give them the opiates. And everyone was doing this because they thought it was like if you decrease the pain, you're decreasing the stress and cortisol, you're improving their ability to heal because the stress levels are lower if you treat the pain. And unfortunately, it kind of led into this mass epidemic over the last 20 or so years. And it's just, unfortunately, it's perpetuated itself with the new advent of these other drugs now, because it kind of was dying down a little bit because the DA was cracking down on the oxycodones and oxycontins, and it was really clamping down. You can't even write a paper prescription for them anymore. You have to do it electronically. So they were getting rid of all the ways that people were diverting these oxycodones and other opiates. But again, by doing that, and then here comes the synthetic drugs, now we have a bigger problem now than we had with the opiates and OxyContin, because again, the fentanyl is much easier to overdose and die from than it was from the oxycodones and OxyContin. They weren't that potent, not like fentanyl. I mean, again,
in terms of just taking it and dying right there, the relapse is just deathly.
Is more addictive because again the higher is 100 times higher than heroin. Heroin's already very addictive, right? So now you have one that you like. If you're likely to use it once and not overdose, typically you're going to be addicted to it.
Right.
I mean, the
Right.
rate of addiction of this drug is so high. It's not a one-off kind of drug.
And it's so tragic. I mean, we know people in our industry and friends and colleagues who've passed away from addiction, not just from addiction, but they had a relapse, and they took something, and there was just a small amount of fentanyl in whatever they took, and because they had been away from drugs for so long, it led to them passing away. And that there's been several people in our industry
Absolutely.
and just people that we know, because we deal with addiction and clients and colleagues, that we see it firsthand. And so
And then also a lot of these drugs now today, you don't know what you're getting. People, it's like you see it on the news all the time. De Niro's grandson and other people's family and the other actors, they're getting drugs and they're buying drugs, and it looks like it may be, say, if they wanted to buy Xanax.
right.
And they bought Xanax. They've been buying Xanax from this guy for whatever long period of time. And they get some Xanax, and guess what? It's fentanyl in there.
Wow.
So
They don't even know they're
they don't even
taking
know
it.
you're doing it. It's,
Wow.
it's everywhere, and that's a problem. So it's not even like you're building up tolerance to it, because people can build up tolerance to it. But most of the people, a lot of the people, a fair amount, the ones who are actually overdosing and dying from it, typically don't realize they're using it or use as much. You
Right,
know?
right.
And unfortunately, they use it kind of like playing Russian roulette.
Right. And that's the scary part. I mean, one thing I wanted to ask you is, we a lot of parents out there, they're worried about their kids, and whether their kids are younger kids, adolescents in high school and junior high, or even young adults. No matter what age your kids are, you worry about your kids. I have 3 small kids. I know a lot of other parents who worry about their kids, and it could be anything from the stories you hear on the news about, oh, it's Halloween and somebody's putting fentanyl in candy, to what's happening at schools, to how can I identify if my kids are in trouble. And so what can you tell the parents out there as far as how to educate your kids, and also what to look for in behavior and things of that nature, so they can try to get ahead of this?
So I always tell parents that, kids' life in general, when you think about it, is school, home, family, and peers, right? Those kind of, because they're not working, unless you have an older adolescent who's working. Typically, you can look at those 3 realms of their existence, and something's going to be off, right? School, the grades are going to be going down. They're going to be ditching, or hanging around with the wrong people at school, or using marijuana or other drugs at school. So there are going to be some issues with school, definitely. There's going to be there may or may not be some issues with peers, either changing peer groups, for example, and hanging out with those kids who are probably using drugs or doing other things. And of course, there are going to be some issues at home. Eventually, it's going to trickle down to issues at home. It could also start in one of the other 2 places too, right? You can start having some problems at school first and then end up going at home as well. So there's going to be some problems at home, either leaving and not being at home, or just getting in arguments with family, like those commercials you see when kids are arguing with parents. That is real.
Right.
So those 3 things, usually there's going to be something off in those 3, and parents can go back and kind of like, they can even pinpoint when they see some of the decline in grades, for example, or ditching, for example. And of course, usually the behavior typically starts before that. Those things become a problem, even if it's just marijuana and other things. Marijuana certainly can, and we do know this scientifically, it does potentiate the effects of other drugs. So we call it, it is true, it's kind of the gateway drug in some ways, because, for, let's say it was alcohol or benzos or other things that potentiate the high, and certainly makes it more addictive in nature. So that's why we call it a gateway drug, because if you potentiate the effects of other drugs, it's easier to become addicted to it, right?
Right.
Because your high is much more, just kind of like some kids would take Xanax so they can get higher or get more of effect from alcohol,
Got it.
right? Because it will potentiate the effects of alcohol. Marijuana do the same thing, basically. So we always tell parents to look out for that. It's like, oh, marijuana is legal. That's a dangerous part. Saying, oh, it's legal is, people use it or got it. But it really, your brain, kids, their brains at those ages and the potentiate the effects of getting high, it kind of set up really a dynamic there that really can be a huge problem in kids, leading to a pathway of addiction and mental health issues too. Because we're talking about a brain that's still developing, and you expose that brain to drugs, whether it's alcohol or marijuana or opiates, and unfortunately there's a lot more kids using fentanyl and heroin in high school and in grade school, and those things are getting it. It's that simple. Again, some of them, they're not knowing that they get it, and some do. So
Right.
it's really concerning.
You mentioned Xanax and mental health, and so I want to talk a little bit about, because we talked a lot about addiction and drugs, and obviously that itself is such a huge topic, but there's a lot of kids out there and also a lot of adults who have increased levels of anxiety, depression, whether it's because of social media and the images that they see on there, to peers, like you said, to just this, things have become more expensive. There's a lot of financial and economic pressure. And so, whether it's social, economic, it's just been, in my opinion, and just kind of what I've seen as a layperson, the trajectory of mental health and suicide and things of that nature has increased, and especially in the younger adolescent and young adult community. Can you tell us a little bit about what you've seen on your side as a board-certified psychiatrist and somebody who, deals with this stuff day in and day out? Just talking a little bit more about Xanax and anxiety and just other mental health issues that you're noticing.
Sure. Depression has seemed like it's increased. I was just watching TV this past week, actually. There was the study on suicide, the increased rates in suicide over the last couple of years. It certainly are going in the wrong direction. It's increasing significantly. Again, we're associated, I think, more with this anxious type of depression. Back 20 plus years ago, we always talked about low cortisol depression, kind of sleeping and just not being able to move, not being able to eat, kind of a melancholic type of depression. These days we're seeing more kind of an anxious depression, more anxiety associated with kind of high cortisol, high stress. And in today's environment, that's not too surprising. We're seeing more anxious depression. The problem with that anxiety, though, having that level of anxiety, at the same time you'll see more suicidal behavior when people get anxious and panicky, versus the more melancholic depression. They usually don't have enough energy to even do something like that, or attempt suicide. But certainly the more anxious type of depression, and that also you see more correlated with the drug use as well. There was a huge study about opiate use that if you didn't have an anxiety disorder before you start getting hooked on opiates, you develop one afterwards.
Right.
So now you have, after a period of opiate use, heroin use, if you didn't have any anxiety disorder, you tend to have one afterwards that you need, and it didn't go away after stop using it. So now you kind of prime your brain, because these drugs do change the brain. So now you kind of prime your brain to having some anxiety after you stop using. So you have to, guess what? You have to treat it now. So now you're treating the addiction issue and the anxiety issue, because you're going to still have this anxious type of quality about yourself after a certain period of use.
Right.
So it has led to the utilization of more mental health and dealing with anxiety, people developing stress responses, and you'll see people more prone to developing PTSD symptoms.
Okay.
Again, because PTSD is a form of anxiety disorder in and of itself. So if you have this chronic level of stress, even small degree of changes in that can set up a stress response. And it's now because your brain was on drugs during this period of time, that small response, and it could be something insignificant. It doesn't have to be life-threatening that people develop trauma from.
Right.
But now they develop this trauma because of this coexisting drug use. So guess what? You may be treating anxiety, depression, and PTSD.
Right.
So it has, and at the same time, it kind of feeds into itself because people who develop these issues are more prone to relapse because usually they have regressive coping skills in dealing with stuff, right? So
Right.
things tend to trigger them more easily. And when they're triggered, that typically leads into a relapse, and now they're on this hamster wheel going of constantly re-traumatizing themselves and constantly relapsing, and then they're figuring out, why do I keep relapsing?
Right.
You know, it's been to 5, 10 rehabs.
Right.
And then they're triggered and they relapse, triggered and relapse, detox, and it's constantly doing the same thing over and over again. Very hard to get out of the hamster wheel when you're in it. That's why it's so important for people to kind of separate themselves from their environment and other aspects of their lives that they constantly re-trigger, that are re-triggering, and to get into treatment and try to hit a reset button, because it's really, back in the old days, we usually said, you shouldn't have to go to a new environment, because the same thing can happen in a new environment, so we kind of preach this,
Right.
we learn how to stay sober in your environment. These days you have to kind of get out of your environment because the drug is so addicting. People find out that they're doing the same things over again, the same re-triggering events, and if you don't change some of that environment, it does risk relapse for sure.
Thank you for that. One thing I've noticed, and like you said, a lot of people, based on their drugs, or mental health, whatever it is, they take enough drugs where they can't take it anymore, and they reach out for, either they reach out for help or their family reaches out for help, and that's where they go into the inpatient facilities, right? And that's detox, residential, or hospital-based treatment, and that inpatient level of care. That's where you got to distance them from the drugs, and you got to kind of help them with their withdrawal symptoms and get to a place where they can either go back home or go back into the environment, right? And so one thing we're doing with Ocean Rock Recovery is, it's an online addiction and mental health program, and we really kind of see two different entry points. One is, like you said, they've gone, they had the issues, they went into treatment, and now it's 30, 60, 90 days away after they've been using and they're sober. They've done their inpatient treatment, and so now one thing we've noticed is to prevent them from getting back into that hamster wheel, a lot of times they don't have the aftercare that they need. So with Ocean Rock, somebody might have to go back home, and we want them to be able to have easy access to care, whether it's from their house or if they're in a sober living environment or some other non-inpatient environment. And basically a transition to getting back into the community. By being able to do that online, we can give them that access to care, but also they can have their job or go back to school and start functioning with the continued support of therapists and case managers and the medication assistants and all of those types of things. And so, one thing I wanted to ask you about is, how can an online program like this that you can have easy access to kind of take away one of the obstacles of people getting that aftercare? And what are things that they can focus on when they have gone back into the community and are back at work or back at school, but still continuing with an intensive outpatient or outpatient program? How can they kind of get the benefits of that in order to prevent that relapse and not get back on the hamster wheel?
Well, it's a good question. Everyone is different. I think it is really important for people to stay engaged within a community of sobriety. There's different ways of doing that. I understand that everyone is a 12-step type of person, but there's other programs like 12-step and getting some peer support. And if it is someone who is also suffering in any particular way with anxiety and depression, to get the therapy and seeing a psychiatrist And so I always suggest, we all suggest that everyone work their program and develop their program. So starting off, understanding what that program is for them, and continue to be engaged within that program and community and individual work, whether it's professional or even if it's just personal, because that could be a trigger for you. So addressing all the different triggers.
Okay.
Right. And, unfortunately, when people use drugs for a period of time, it regresses you. In other words, your coping skills are usually a little bit immature, and your ways of dealing with things are usually not very healthy. Because a lot of times people say, they come home after a stressful day and they want to drink.
Right.
Or they want to use drugs. They get in an argument, and instead the argument was triggering and it caused them to relapse. So hopefully developing better coping skills and ways of handling those aspects, because life is difficult. There's going to be struggles throughout it. And so whatever issues that people have that causes them to relapse or tends to have them think in regressive ways and not really focus on their sobriety, they certainly should seek help and have that community to kind of help deal with things better. If it's cravings, get on medication to help with cravings.
Right.
So there's so many different ways that their program can work for them. So
Got it. The other entry point that we see is earlier on. So instead of going into detox or inpatient programming, you don't have, not necessarily wait till you hit rock bottom. Seeking outpatient programming, intensive outpatient programming as a preliminary step, and then with the idea that if that can help you, you don't have to go into it. Now, sometimes that works, sometimes that doesn't. So ultimately, we'll have people in the aftercare program if they've gone through treatment. But as an entry point where this could be your first attempt, how can somebody or their family have the kind of mindfulness to start here rather than waiting until it's too late and they're really, on the streets and needing inpatient treatment?
Yeah, definitely when families approach the individual who is using drugs and they agree to treatment, if it's possible, sometimes, a lot of people would be more amenable to treatment if it's not so intensive. And so for that particular individual early on in using, that's a very good way of starting introduction into some treatment and some other ideas. Of course, person has to be ready for it and agrees to it and see that there's a problem and willing to address that problem. And then, of course, willing to do the work for that problem. So there's a few leaps there that have to be present for someone to be serious to get into the treatment, or at least open to attending some type of a treatment program, whether it's as an outpatient or inpatient. So definitely can be the earlier on you address this, right, the better it is, right?
Got it.
The longer they're using, the more deeper they go into, the medical and psychiatric comorbidities that are there. So early intervention, of course, is by all means best.
Got it. And then, kind of lastly, there's so many questions I can ask you. I mean, you have a wealth of knowledge. And, the sad part is a lot of people go on Google and they start looking things up and they get a lot of bad information. So for you to come out here and kind of answer these questions and tell people what they should be looking out for is extremely valuable. So we thank you for your time for that. Kind of as a last question, a lot of people that I talk to who are not as familiar with addiction or mental health, either look down on it and they say, okay, well, those people, or even if they're going through it, they say, I'm not an addict, or I'm not, I don't have a disease. And so how much of this is a choice and is based on willpower versus how much of this is a disease and it's just not necessarily something that somebody chose to do or has a control over? I think a lot of people have a misconception about this.
And I think some of that is because it's not clear, totally, right? I mean, there's certainly some people are very prone to drugs, in other words, becoming addicted to it, so there is a brain issue. that some people develop addiction. Look, not everyone who experiment with drugs become addicted to it, right? I mean, there's plenty of people who go to college who experiment with alcohol and cocaine and some other drugs and use it recreational and don't develop addiction or dependency to it. Then you have the cohort of the one of the issues with like say fentanyl, whether you have this addictive part of your brain or not, your chances, even if you did or not, becoming addicted to that kind of drug is pretty high. Methamphetamine, the rates of addiction is pretty high as well because the high is so intense. So you have these drugs that kind of, unlike say marijuana and alcohol and maybe some, traditionally snorting cocaine may not lead to an everyday addiction. These other drugs typically do because the high, once you experiment or do that once or twice, you're off to the races no matter who you are, right? Now, the brain part comes into some people or can get off of it a little bit easier and may not relapse as far as or have the same type of relapse potential as some, so there's the brain quality to it as well. So it is so complicated. Obviously, starting using drugs, obviously there's a choice, right? Whether it's using gateway drugs like marijuana or other drugs, or even just starting just, hey, you want a hit of this, or hey, you want to try this. Obviously, there's a choice there, right? But again, with some of these other drugs, it becomes a problem that the choice is taken away from you because I've seen some people do some crazy things just to get that drug. I mean, again, it's like Russian roulette. You may not live. You just think about it. You're using a drug and you know it's a possibility because you're seeing other people die from it, that by using this, even a small amount, you may not wake up, but you do it anyways.
Right.
So just think about the intensity of that thought for a second. There's certain steps, whether it's buying it, putting in a form where you're injecting it, putting that tourniquet around your arm, putting it in a syringe and inject. So there's all these points. You have to come to some thought each step that I may not wake up from this, but then it's so addicting that you decide to.
It's hijacked your brain. You're not in the.
You're not worried about the risk.
Right.
You're not worried about the risk of dying because you want that drug so bad, and so you're totally hijacked. And so it doesn't become a choice anymore.
Wow.
It's like, why do you do that? Why you ask them and they can't even tell you why. It's like hijack is a very good word for it because they know it. They know that they could die, but they don't know why they did it anyways. But they needed it.
Right.
They have to use it. So that's the most dangerous part of this. I guess
scary.
I guess you want to call it this phase of this epidemic. Most epidemics you tend to see kind of die off after a certain period of time, especially all the measures that we're doing. The DEA regulating it harshly, prosecuting people who are over-prescribing it, right? I mean, we have huge prosecutions, even prosecuting the drug companies and fining them, right?
Right. We've seen a lot
of people went to jail for this. And then it goes to this phase where it was kind of dying down, and now it's gone up significantly to a point where it's almost like, I don't even see a point of return. Maybe hopefully it would balance out a little bit. Because one of the problems we also see is that the risk, we have to think and be mindful of this, working in the addiction field, that when you put someone on Suboxone and get them and detox them, now their brains are even more sensitive to the opiates. So once they get off the Suboxone, now you potentiate the risk of overdose if they relapse, overdose and deaths.
Right.
If they suddenly get off of it and stop and get out of a treatment program and don't continue treatment, we're seeing, again, this risk of overdoses. So it's like even the treatment is fueling some overdoses if people don't continue in treatment. So now a lot of efforts are placed in continued treatment and long-term maintenance of using medications like Vivitrol, Sublocade, and things like that, or even maintenance just Suboxone, because we do know, even historically, we know the longer you keep someone in treatment, the longer their possibility of staying sober, so you can address the medical and psychiatric issues and make sure they understand what the addiction is and keeping them working on their program and really stressing. It's not like you're relapsing on alcohol or cocaine here or meth.
Right.
If you relapse on this drug, I mean, it can really mean death. I've seen people stay sober for a while and one relapse, and it's usually the first time they
Right.
relapse.
Right.
You know, it's not to the point where they develop tolerance again, right? Because if they develop tolerance again,
It's a
they may
one and
not-
done type of situation.
They use it's that first time that after a period of sobriety or getting off of Suboxone, not staying in a program, is that one relapse that could be that Russian roulette deal and overdose. And really, it's not like they plan. They say, "Oh, I can get back into this and use a small amount."
Right.
They can't, and unfortunately, that's kind of the evil we're dealing with, and the significance of drugs that we're dealing with these days is really, really
Well, I mean,
difficult.
we're in scary times, and Dr. Tucker, I thank you so much for your time. I think you've highlighted, what people need to be looking out for, and for our program, Ocean Rock, I think that's exactly why we want to do what we do, because we know that if somebody's already had this issue and they're addicted, just going to 30, 60-day program is not going to be enough, and they need that aftercare, and it can't just be one-on-one therapy. That's a huge important part of it, but with our program, you have a whole team, from the medical director component to the individual therapist to the group setting where you can see your peers and kind of keep that program going. And the longer you're in treatment, the better chance you have at sustainable recovery.
Absolutely.
So if anyone has any questions or wants to learn more about any of the topics today, feel free to reach out to us. Otherwise, have a great day, and thank you for all the hard work that you do out there.
Thank you. Appreciate it.
Thanks.
Great.